Hi, you've probably found this video because you referred to it from your Asclera rep, or you went down some crazy rabbit hole on the internet and found me. But I would love to spend about 10 or 15 minutes with you and teach you a little bit about why adding Asclera to your aesthetics practice can be fun, profitable, and super practical. My name's Jillian Cicchetti. I'm a board certified general surgeon. I've been treating cosmetic spider veins since 2007, and I've been using Asclera since it was FDA approved in 2010. I'm based in Denver, Colorado, and I do offer options for both online and in-person courses, both for sclerotherapy as well as aesthetic lasers. I've developed a system in my office over the last 15 years for treating veins in an injectables practice with excellent return on investment, great profit, great margins, tons of patients waiting to see you, and most importantly, it's an incredibly fun procedure to perform. So why would you consider starting Asclera in your practice? Whenever you bring in a new procedure, there's a learning curve, there's feeling comfortable with it, there's the cost of getting the business model up and running, and there's always a big buy-in. I'm going to tell you why. I am first starting with the assumption that you are a practice that's already doing injectables, that you have experience poking people with needles. And if you have an injectables practice, you're familiar with the difficult parts of running an injectables practice, getting good profit margins, getting your product available. Sclerotherapy with Asclera has excellent return on investment for both your startup costs and the ongoing costs of your product. You can easily get yourself between 70 and 80% profit margins, if not more. This procedure of sclerotherapy with Asclera will bring in a different patient population. So people who aren't coming to see you maybe for Botox, filler, or lasers would come see you for this procedure. So it allows you to tap into a different market. Each patient in your office will require 2 to 4 procedures and will come back for touch-ups every year. Every 1 to 2 years. So each patient has a lifetime value or a lifetime spend with you of somewhere between $900 and $4,000 with an 80% profit margin. Low startup costs. So we can get you started with the class, with product and all that stuff for less than $2,500. And there's no laser or product line, or let alone practically any skincare line that you can get started for that. And that means you can be profitable within the first 5 patients that you see. Finally, I already mentioned this once, but it's an incredibly satisfying and fun procedure. I am 12 years into aesthetics, and if they could fill my day with sclerotherapy, I would spend my day with Asclera. So let's move on to an overview of venous disease. In order for you to find your patients properly and have a very satisfying practice, you have to understand the basics of venous disease and how to choose your patients. So you only have to know a little bit of anatomy. The veins that we're dealing with are not located within the muscle compartment. This is a cross-section of the leg. The veins inside the muscle compartment are the deep veins of the leg, and you will not be working in that space. The superficial veins are located in the superficial fat and the dermis and epidermis. The ones you see here are the larger veins, like the small saphenous vein, or the greater saphenous vein, and we're not really working on those with Asclera. Those are the ones that are worked on in the medical offices. So we're working on the smaller vessels that are located in the dermis and maybe just below it in the very superficial subcutaneous space. The problem with veins, whether it's cosmetic or medical, is that veins have one-way valves. The job of the veins is to put the blood back up the leg and not let it come back down. When valves get damaged over time, mainly due to aging, sometimes due to trauma or medical procedures, you get dilation of the veins and you get problems. So you get these healthy veins with healthy valves that get damaged, usually due to reflux or thrombosis of the vein, and that gives you damaged veins with abnormal blood flow where the blood can go up, but it can also fall back down again. This leads to dilation of the nearby veins, an increased volume that can lead to venous hypertension, leakage of fluid across the veins into the skin, which can create low oxygen content, pain, restless legs, ulcers. That's the medical side of this, okay? Common presentations. The patients you're looking for in your office are the people on the top row, okay? Those are the ones that you can take care of in an aesthetics clinic. The ones on the bottom row are questionable, especially this one with the big ropey veins, and I'll give you a hint of who you shouldn't treat in your office, okay? When you're looking at veins on the legs, We all know telangiectasias. We see them all the time. We treat them with lasers, and these are usually less than 1 millimeter in size. They're fine and they're red. Venulectasias are a little bit larger. They might be a little bit purple. They're usually 2 millimeters or larger. Reticular veins, 2 to 4 millimeters. They can be purple or blue. Asclera is FDA approved for anything 3 millimeters and below. And finally, you have varicose veins, which are the ones that are, the size of your finger. You should not be treating those in your practice. So the easy ones, telangiectasias and venulectasias, those can be treated in the office. Usually I reach for sclerotherapy for both of these. You can also add laser if you're just dealing with fine telangiectasias, but only after the feeder vessels have been treated with Asclera. If you have patients with the larger reticular veins greater than 3 millimeters or varicose veins, these are going to need a medical evaluation. I'm going to go through what happens in a medical evaluation in the next part of this video.